Hello, pelvic empowerment people. Welcome back to the Pelvic Empowerment Podcast. I am your host, Dr. Liliana, and today we are going to be discussing the pelvic floor. So, the pelvic floor is a group of muscles that lives within your bony pelvis, and it is one of the, if not the, most foundational aspect of the body that we work with when doing rehab at the pelvis, so when treating pelvic floor dysfunction. The pelvic region is also made up of a bunch of other structures. We have the pelvic bones, the ligaments, the nerves, the blood vessels, all these different anatomical structures that contribute to your pelvic health and wellness. But your pelvic floor is the group of muscles, it's the musculature that lives there. And I wanted to create this episode to help illuminate a little bit of what's going on at the pelvic floor level, because I feel like we are starting to talk about pelvic health more and more, like on a grand scheme, which is really great, and I'm really excited about it. But I do think that sometimes it can be really easy to be talking about pelvic health, pelvic wellness, throwing around the term pelvic floor and not really knowing, like not having a really clear image in your mind of what's being talked about. And my philosophy, like one of the biggest underpinnings of all of my work is this framework, the know, love, listen framework. And so I really, really believe that if you know what's going on in your body, like if you have that really strong foundational education and understanding, that can then lead to deeper love and acceptance of your body. And if you have that knowledge and that acceptance, then that leads you to want to listen to your body, to want to build that relationship, that empowered, embodied connection to your being, your physical being, as well as your emotional and energetic being. And that's what creates that most empowered life, because you are listening, you know your body signals, you know what your body's saying, and that's what brings you to like make really empowered medical decisions or just decisions about your life in general. So again, the foundation for that is knowing, really, really deep knowing. Knowledge is power. Education is, like, for me at least, the way that I teach, the bedrock of everything. So before we go into the treatment of your pelvic floor, which is very personalized, we can start with this broader education and almost like deep dive into what the pelvic floor is, what it's supposed to be at baseline, its function, things to look for. And again, having this knowledge and understanding, yes, it helps build your self, your body love, body acceptance, and your like intuitive understanding and connection to your body, but it also just helps in general with symptom identification, dysfunction identification, like understanding where your baseline is and where you want to be. Because if you don't know, you don't know. You don't know what you don't know, So, so this information feels really important for me to share with everybody, but especially with those of you that are really interested in expanding your connection to your body and deepening in your pelvic wellness journey. And as far as timing goes, this worked out really well. I'm really excited to be talking about this today. I just came home from my holiday trip. I got to go back home for Christmas and New Year's, and in being home, I had access to all my stuff, and I grabbed my pelvis. So I have my pelvis model with me now, which I'm really excited about. I haven't had my own model in my own space for the whole year I've been out here, so this feels really, really special. Now, if you're watching, you'll be able to see the model, but if you are just listening and not watching, no fear, because I am only going to have one hand to work with, so it's not going to be the most in-depth, modeling. This mic it's a cheap mic. I need to keep it close to my mouth. I've tried. I did a bunch of troubleshooting prior to filming this. I had it clipped to my shirt or to my glasses, and the quality was bad. So we are gonna do the best with what we've got, and then maybe in the future we'll re-record. Who knows? But I think it is enough of a an illustration. I think it's still worth looking at. So let's dive right in. So I've already mentioned that the pelvic floor is the group of muscles, right? So Here we go. Anything red, and if I bring it close to the camera, you'll see anything red with little lines on it, that is striated skeletal muscle. So we have different muscle types in the body. Striated skeletal muscle is the muscle that contracts and relaxes voluntarily at will. So like our bicep, you squeeze, that muscle contracts, and that angle between my upper arm and my lower arm gets smaller because the muscle is what's pulling those two bones closer together. So our muscles, one way to think about it, like biomechanically, the purpose of our muscles is to contract and to change joint angles. So like the shoulder is another example. If I contract the muscles around my shoulder, I change the angle, I change the angle between, let's say, my neck and my arm. So see how that angle gets small? Now the angle gets big. That's thanks to the muscles attached at the shoulder joint. So the pelvic floor, so striated skeletal muscle. The big concept here is can contract and relax voluntarily at will. We should have as much of an awareness and control of our pelvic floor muscles as we do our biceps and our shoulder muscles, our leg muscles, all those other muscles. We have other muscle in the body that we don't have voluntary control of, like our cardiac muscle, our heart muscle that just goes on its own, our smooth muscle, like our digestive tract. We can't really impact what's going on in those organ spaces. But anywhere that there's skeletal muscle, we can. So I say this to highlight that even if you've never really placed any intention on this group of muscles, know that it exists and that you should be able to feel it, you should be able to contract it, you should be able to fully relax it. Now, if you haven't used these muscles before and you've not built up your strength, your awareness of these muscles, the signals may not feel very strong. Like you may try to squeeze these muscles and it may feel either very weak or very faint or even numb altogether, and all of that's okay. That is a normal byproduct of not having trained these muscles. It's the same thing like your other muscles. You know, if you had never, let's say you had never seen or used your left arm your entire life, if I told you, okay, now squeeze your left biceps, you wouldn't feel it as much, you know? And that's another big thing to consider with the pelvic floor. We can't see it. All of our other muscles, like our proprioception, our ability to feel what our body is doing in space, is bolstered by our ability to see what's going on. So if I say, so again, like take that example, if I've never seen my left arm my entire life and someone says, squeeze your bicep, it'll be really hard. But then if I can, let's say that I could see my arm and someone said, okay, now squeeze your bicep, it's this muscle right here, that would be helpful in my ability to feel it. Another thing is tactile feedback. So the brain, so we use all of our senses in order to navigate the world, use our body, do the things that we want to do, make plans and take actionable steps to make them happen. So something like our sense of sight is really helpful. So again, if I can see my arm, it's easier for me to contract it. The other thing is touch and feel. So sensory input, adding that like tactile stimulation is another input in the brain that can help increase the awareness, the proprioception, the muscle activation all the way down the chain. So when it comes to the pelvic floor, it's important to remember that we can't see these muscles. So that is a challenge. Give yourself grace. We can feel these muscles though. You can palpate them, as in palpate means to touch. So and palpation typically is like touch to assess. So as a physical therapist, I will palpate your pelvic floor to let you know what I find. But you yourself can also palpate the area. You can touch, feel, assess to see what is my baseline of these muscles. Do they feel really, really tight, like a neck muscle after prolonged stress? Does it feel really soft, maybe the way your muscles feel after a massage? You can assess your pelvic floor from the outside. And in addition, we do a pelvic exam in pelvic floor PT, which includes an internal assessment. So that would include one gloved and lubricated finger inserted via either the vaginal canal or through the anal opening, and feeling from the inside all of these different muscular attachments. So we can use our senses differently to build our awareness of our pelvic floor. This is also, I want to highlight, it is really, really important to see a pelvic floor physical therapist if you're having symptoms before just attempting any random exercise. I've seen a lot of exercises just like on TikTok, on YouTube, whatever. But if you don't know your baseline, the baseline of your pelvic floor, it's challenging to know what exercises are going to be supportive for you. And the reason for that, the reason why it matters so much is because your pelvic presentation, your symptoms, and any dysfunction that you may be experiencing oftentimes can present as a result of your pelvic floor being either too taut, like if it's holding too much tension, or if the pelvic floor is too lax. So you can have the same symptoms, the same presentation, and your pelvic floor be presenting in two completely different ways. The reason for this, why that happens, is because the pelvic floor, in order for it to function optimally, it needs to have access to its full range of motion. So let's bring the bicep back as our example. So if I hold my elbow up to the side and I leave my fist pointed up towards the ceiling, that is, let's call that neutral. That's mid-range of the full range of motion of my elbow joint. So when I fully contract my bicep muscle, my fist gets really close to my shoulder. When I fully relax and lengthen my bicep muscle, my hand gets really far away from my shoulder. Now, we want access to this full range of motion at the bicep and at the pelvic floor in all of your tissues, honestly. So again, back to that symptom presentation. Let's take something like bladder leakage. So that's, if you have urine in your bladder and some comes out when you don't want it to. So if that can happen with sneezing or laughing, or jumping, lifting, heavy lifting, that happens often. Some people may say, okay, you're leaking, that means that your pelvic floor isn't strong enough to keep your sphincter closed. Therefore, naturally, we need to strengthen your pelvic floor. However, this may not always be true, because yes, if your pelvic floor is lax, if it is too long and it doesn't have that tensile contractive strength, correct, you cannot keep that sphincter closed. However, if you are stuck in a taut and held position, you also cannot produce an effective contraction. So whether the pelvis is presenting with laxity or what we refer to as hypertonicity, so hyper meaning more, tone meaning like held tension, whether, and then the opposite being hypo, right? So hypo being less. So whether we're presenting with hypotonicity, low tone, laxity, or we're presenting with high tone, hypertonicity, both of those states result in an inability to fully contract and effectively use the pelvic floor. Both of those states can result in leakage, poor pressure management, pain. So it's important. My point in this is it's important to get assessed to find out your baseline, because just because we know the symptoms and the way that your pelvis is presenting as far as dysfunction, like just because we know your symptoms doesn't necessarily mean that we can with 100% certainty deduce the root cause of that symptom. The only way is to do an exam, to feel the pelvic floor, and to see what is the resting tone of the pelvic floor. So, in summary, an ideal, healthy pelvic floor, optimal pelvic floor function means that you have access to your full range of motion, full strength, full relaxation, ability to contract at will and relax at will. And an inability to do so effectively in either direction can result in dysfunction. Okay, so let's follow that up with a little bit of a anatomical show and tell here. We have here the pelvis. Your bony pelvis consists of 3 bones primarily. So this whole big thing is 3 separate bones working together. each half is referred to as an innominate. So you have your left innominate and your right innominate. And then the innominate has 3 parts each. So you have your ilium, which is that part where if you put your hands on your hips, your ischium, which is the part that you sit on. Like if you were to rock back and forth, you would rock on your what's referred to as your ischial tuberosities. Sometimes like in yoga and Pilates, we refer to this as your sits bones. And then in the front, you have your pubic bone. So the ilium, the ischium, and the pubis are the 3 parts that make up the innominate, and you have 2 innominates and 1 sacrum. And those are the 3 bones that make up the pelvis. Now, the connection site between your ilium, your iliac crest at the top, and your sacrum, that sacral border, creates your SI joint. So sacroiliac SI joint. There is some movement and some play at this joint. So that is back here. You see kind of like that squiggly line right here. Here and here. Those are your SI joints. And so there can be some movement at the pelvis. And as well, in the front, there is connective tissue, that thing that looks like a little pillow in between the 2 halves there. That's your pubic symphysis. So movement at your SI joint is necessary, like a little bit of movement is necessary for load distribution, transfer of forces, especially as you're doing things like walking, running, even like throwing, like that's kind of like rotational force. It's important that the pelvis can stay stable, that it can do both. So it's all about balance. This is why I love this work, because it's all like such a metaphor for life. As fascinating as it is, just from the anatomical and physiological biomechanical perspective, it goes even deeper because it's always such a metaphor for life. So we need balance. We need balance at the pelvic floor, balance at the joints, balance all throughout the tissues of the body. So balance at the SI joint means that there is enough movement and play to distribute forces, but there's also enough stability to prevent pain, again, keep us stable. This is our pelvis really is like such a base in the body. It's our, especially for female anatomied bodies, it's your center of gravity. So your pelvis really controls where you go in space. It's your base when you're sitting, like I'm sitting up on my pelvis right now. And it's your, again, center of gravity when you're standing. It's this big irregular shape in the body that is kind of like the center point for your spine to extend up off of and your limbs to then extend off of. So stability at the pelvis is really, really important. We need that stability there. The pubic symphysis at the front, that little pillow that I showed you, that is connective tissue. And the purpose of that, it kind of keeps the 2 halves of the pubic, so that front piece. And if you like tap down, like if you tap your fingers down your belly all the way down, you'll feel that bony stop. That's your pubic bone. The pubic symphysis, the purpose of this, it's connective tissue, and it is meant to kind of hold the 2 halves together. This connective tissue expands and opens in order to accommodate childbirth. So we need a flexible pubic symphysis in order for the pelvis to do what it needs to do. So back to that conversation about like balance and stability, we need the pelvis to stay together most of the time, but we also have the ability to open up when we need it to, and we really only need it to open up for childbirth, but that's like a really important time and function, so we want that that function to remain intact, healthy, super supported. So we have the bones, that creates the bony rim, and then your pelvic floor. All of those striated skeletal muscles, you can see they kind of line the bony rim of the pelvis and then down along the sacral borders and to your coccyx, i.e. tailbone. And they connect from the front, so the pubis, so pubic bone, pubic arch, down to your sits bones, and again lining the entire inner rim. And because of the way that it lines the bony pelvis, it creates a bowl of muscles. So in contrast to a muscle like the biceps, which is very linear, it attaches from my shoulder to my elbow in one straight line, the pelvic floor is a bowl of muscles. So it scoops down like a hammock. And the reason that one of the functions of it being this way is because it needs to hold up and support the pelvic organs. So your pelvic organs, including the bladder and the urethra, which comes down out of the bladder. That's the tube that your urine flows through. So you have the bladder, then you also have the vaginal canal and the uterus. Oops. Your uterus being your sexual reproductive organ, and then the vagina, vaginal canal being the connection point between the organ itself and the outside world. So baby comes down through the vaginal canal during birth, but also your menstrual blood, and is a vessel for penetration if you're having penetrative sex. So very important structure. And then we have your rectum, the last part of the large intestine. So this is also a very important, obviously they're all very important, but pelvic organ to consider. And all of these pelvic organs sit inside of the pelvic bowl, just like that, like a perfect little puzzle. And they are supported by that hammock or sling of muscles. And I think this is something that we kind of take for granted. If you think about it, like, you have your abdomen, you have your torso, right? It's this canister, and we know that inside of this canister we have like our stomach and our liver and our intestines. Like, we know these things live in there, but have you ever thought about like what's stopping all of these organs from just like falling out the bottom of your torso? It's your pelvic floor. And I think we don't tend to talk about it like this enough. Again, we kind of just take it for granted that everything just stays where it's supposed to. But again, the pelvis is the bony pelvis is a ring. It's open underneath. So the pelvic floor really needs to be working effectively and efficiently to support your pelvic organs. If your pelvic floor isn't functioning optimally, efficiently, that's when we see pelvic floor and pelvic organ dysfunction. And we don't want that. We don't want that. So again, it's important to build a relationship with these muscles. So now back to it being bowl-shaped. If we compare it to the biceps, right, we know that the biceps is relaxed because that line, think of it, I like to think of our muscles as ropes. So your muscles are the ropes and your bones are the long pieces of wood that these ropes are pulling on, right? So if you have your forearm is one long piece of wood connected to your upper arm, another long piece of wood. Your biceps is the rope that is pulling that forearm up closer to the upper arm. So when we have linear muscular connections, that is typically what we see and what we can expect. That, again, the muscle contracts, it pulls, that joint angle becomes smaller. The pelvic floor is unique because it is a bowl. So instead of it just operating like a linear pull, it's more of this round bowl-like pull. So when you lengthen and relax the pelvic floor, that bowl deepens. And then when you contract and activate your pelvic floor, those fibers crisscross over each other and that bowl gets really shallow. So the range of motion that we're looking for is this even, almost like 360 expansion and then contraction of that bowl. So that widening, opening, and almost like this like filling type of feeling, and then that coming together, squeeze, overlapping, contracted feeling. It's almost like, do you remember those big balls that they were like kind of zigzaggy, and you would pull the ends apart and they would like expand and contract and expand and contract. I don't remember what those were, but I feel like we all had one as kids, and they were like really colorful. Anyway, that's the image that I want to kind of associate here. And in pelvic rehab, pelvic wellness, pelvic floor PT, we do various things to help facilitate both that relaxation and lengthening and that contraction, again, for full range of motion. So let's just briefly review why you may need that full range of motion. So obviously we touched on just like the general point here that you need your full range of motion for effective and efficient muscular control. But I want to highlight some more specific things as well. So let's start with pelvic floor relaxation. Why is pelvic floor relaxation important? The primary thing that comes to mind for me is bladder and bowel emptying. So if your pelvic floor is in a constant state of tension, of holding that contracted, short, like shallow bowl position, it is going to be more difficult to empty fully, because the space, like the pelvic floor, like if you look at it underneath here, it those muscles wrap around the three openings of the three pelvic organs. So you have muscles surrounding your urethral opening, your vaginal opening, and your anal opening. And if those muscles are tight, it's going to be difficult to have easeful evacuation. So this is one of those things that I talk to my patients about, that a lot of people like aren't aware of, just because we've never talked about it. Once you talk about it, you're like, oh my God, that makes so much sense. But like peeing, right? A lot of people have trouble emptying, and they're either like pushing, or they're like they feel like they have a hard time starting their stream. And for a lot of people, that's because when they go to the bathroom, it's like a forceful event. Peeing, bladder emptying, and bowel emptying are supposed to be relaxation events. These are supposed to be moments that you sit and you fully let go, and as a result of letting go, that's what allows you to empty fully. If you are forcing, if you're pushing, if you're like really like exerting or like bearing down, you're going to have a harder time. And not only is it going to be hard in the moment, there can also be consequences to that later on for other types of pelvic organ health, like prolapse. So you need to be able to fully relax your pelvic floor in order to fully evacuate effectively. And the best way to do that, again, is to build that connection and awareness, so that you know, okay, what does my pelvic floor feel like when it's relaxed? Can I replicate that feeling in this moment? So instead of just kind of leaving it up to chance, building the connection so that you can voluntarily relax your pelvic floor and evacuate the way that you were meant to. Pelvic floor relaxation is also really important for pain management. If you have menstrual cramps, a high tone pelvic floor, so that, again, that tight held pelvic floor, is going to worsen your cramps. Your cramps, uterine cramps, are like that contraction of the uterus. And if the pelvic floor is already in a state of heightened contraction, there isn't as much room for like free flowing blood flow, and it can contribute to inflammation, and it can just contribute to the sensation of pain overall, because everything is squished and tight versus long, relaxed, and spacious. Sorry, plant, I keep hitting it. So that is another reason why we need a relaxed pelvic floor. Again, on the theme of pain management, penetration, period. It doesn't even have to be penetrative sex, but like even penetration for like a pelvic exam is going to be more difficult if the resting tone is really high. So again, we were just talking about like the muscles around the urethral and anal sphincter. If the muscles around the vaginal opening are also really gripped up and held, it's going to be difficult to insert anything. And so, especially when it comes to pain with sex, though, I want to highlight, I think a lot of us were kind of, I don't know if we were taught or if it was just like kind of the accepted thing that like, oh yeah, it's going to be a little painful, but like it's fine. And I've heard stories about like gynecologists or OBs being like, yeah, it's normal for everyone, just drink a glass of wine before you have sex, it'll be fine. And that's not true. There's a lot that you can do to manage pelvic pain. And again, if it's in your voluntary control, let's say you're going to have sex and you initiate penetration and it's painful, if you have that voluntary control, you can kind of communicate with your partner and coordinate like, okay, we're going to take a little pause. I'm going to breathe into my pelvis. I'm going to try to actively relax these tissues to make the process run a little bit more smoothly. So those are some reasons why we need pelvic floor relaxation functionally. And then pelvic floor activation, we need to have a really strong and like really fast acting pelvic floor. Like it's one thing to have really good strength, but it's another thing to be able to recruit that strength really quickly. So one of the things that we do in our pelvic floor physical therapy exam is test, so in the exam, we're testing, okay, what's the resting tone, but also what's the coordination? Like, do you have the coordination to actively squeeze on command, and then can you fully relax? A lot of my patients, they can squeeze, but then it takes a really, really, really long time to fully let go. So we need to have the coordination. And the endurance. Endurance is another factor here. We need to be able to hold that squeeze because pelvic floor activation is super important for pressure management. So again, kind of like that image that I gave you of like, if it wasn't for our pelvic floor, everything would just fall out. It's a similar concept when we think about pressure throughout the torso and the abdomen. So intra-abdominal pressure, when we are increasing pressure within our abdomen, within our torso, that pressure pushes down on the pelvic floor. And if the pelvic floor isn't strong enough to negotiate that pressure, to withstand that pressure, we will have pelvic dysfunction because we're not meant to take a lot of force over and over through the canister. We need to be able to support it with muscular strength, coordination, and endurance. So pressure management is the big one. Some dysfunction that can happen if you do not have a strong enough pelvic floor. The big one is leakage. Urine leakage and also fecal leakage can happen as a result of a weak pelvic floor. And again, we need that coordination because we need your pelvic floor to be able to turn on at a moment's notice, like right before you sneeze. That's an exertion moment. Like when you cough or you sneeze, you feel that pressure in your belly. That's the pressure that we need to be able to bolster up against to prevent that pressure from pushing urine or poop right out of us. So you need pelvic floor strength to prevent leakage. You also need it to prevent prolapse. So prolapse is that downward descent of the pelvic organs toward the outside of the body. And your pelvic floor is, again, pressure management, what is necessary to support all of your pelvic organs. If you already have prolapse, increasing your pelvic floor strength is a great way to manage prolapse. Sometimes it's not possible to reverse it, but it is really, really important for the management of, and just like any other medical diagnoses, prevention is the best. So if we can prevent prolapse by, again, creating this connection to your body and learning how to effectively use your pelvic floor, you save yourself a ton in the long run. Another thing I kind of want to touch on is pregnancy and postpartum, because these are times when your pelvic floor and your pelvis in general is changing. So there's a lot that happens during pregnancy and in the postpartum, and your pelvic floor, your bony pelvis, things are shifting and changing to support the development of baby, to promote a healthy delivery and birth, and then to return back to your baseline. And this is another example of where we really need that balance, because as baby is growing and pressure is increasing in the pelvis, you need to be able to have the strength to support your baby, first of all, but then also to support your body, because if you don't have a strong pelvic floor and also pelvic floor and core connection, maybe that'll be another video too, because the pelvic floor and the core are really, really deeply intertwined. If you don't have that strength, that is one of the leading causes of pain in pregnancy. So that low back pain, that SI joint pain. So again, that joint we talked about, sacroiliac, that really low kind of on the side pain in the back, as well as pubic pain in the front, pelvic pain underneath. All of these pains can be worsened, if not completely caused by weakness of the core and the pelvic floor. So we need to have the strength to support pregnancy. But then during labor and delivery, you need to be able to relax your pelvic floor. And I've seen it a handful of times where people come in, especially athletes, where they're like, no, I know I'm strong, I feel great, I feel fine, but they don't know how to fully relax their pelvic floor. So then when it's time to give birth and baby's coming down, they're trying to relax and they're subconsciously squeezing, which is making it so much more difficult for baby to come down and out. So again, we need that full range of motion, that voluntary control, that deep known connection, and also intuitive connection. I want you to be able to visualize what's happening. So on a very factual level, to be able to say I know what my pelvic floor looks like, I know what it's doing, but then to also be able to say I feel my pelvic floor, I know what it's doing, but in a completely different sense. So to have that like felt intuitive connection to your pelvis and to your pelvic floor. So let's wrap it up there. I will at some point make a follow-up to this where we talk about the emotional and energetic connection to the pelvic floor, and then another one on pelvic floor and core. But for now, let's pause there. Quick, brief overview of pelvic floor function, range of motion. If you have any questions, please let me know. If you are thinking, like if you're hearing me talk and you're like, oh my God, I think I have that, reach out. I'm happy to help like discern where you're at in your journey. Like if we're not in the same place and we can't work together hands-on, I'm happy to help answer your questions and help you kind of like kickstart your journey, and maybe help you find a provider that's going to be helpful for you. We can do virtual sessions. I offer 1-hour virtual sessions to anyone in the world. And then if you are in my area, I can treat you either at the clinic that I work at or privately in my home. I do offer more deep dive sessions in my private work. So I'll leave all my links down below, but please feel free to reach out and get the care that you need. I hope that I've stressed this enough already, but your connection to your pelvis and your pelvic floor is so important functionally, and also as a metaphor for life. This is your center. This is such an important part of your, not only your day-to-day life, but through so many big life events. So you really deserve to feel connected here. You really deserve to feel empowered here. And I really want you I really want to encourage you on that journey. So as always, feel free to drop any questions or any feedback. I'm here for it. I look forward to hearing from you if you'd like to work together. And if not, I hope this was helpful and informative. And I love you all. I'm sending so much love, so much, I don't know what, affirmation for whatever it is that you need in your pelvic journey. And I'm just honored to be a part of it in this way. All right, we will talk more soon. Bye.